welcome Dr. Bharat Jayram Venkat, Director of the UCLA Heat Lab, Dr. Ben Zaitchik, Morton K. Blaustein Chair and Professor at Johns Hopkins University Krieger School of Arts and Sciences, in conversation with Zahra Hirji, climate reporter at Bloomberg Green.
Well, thanks everyone for being here. We're going to continue the conversation on climate and health. And I'm really excited. We have two experts here, and we're going to really drill into kind of two specific pieces. One of the interesting things about climate is health is this is one of the ways in which climate can actually impact every single person in this room. But it doesn't impact people equally. So, Bharat, you do a lot of work with extreme heat. Can you tell us a little bit about who are the most vulnerable groups that your group is researching and why?
Yeah, that's a great question. So, when we talk about extreme heat, the negative effects of extreme heat are incredibly unequally distributed, right? We often talk about being in the same boat with climate change, but that boat is actually very large, but includes only some of us in particular ways, right? So what we do in my lab is we try to understand kind of what are the factors that contribute to making somebody vulnerable in particular ways, whether those be sociological, biological, the built environment, pharmaceutical even, right? So for example, we know that a lot of commonly used pharmaceutical drugs, whether those be for heart disease, for psychiatric conditions, actually impede our ability to stay cool, to thermoregulate. So for older populations that often take, 4, 5, 6 drugs every single day, they can really feel these impacts strenuously, right? And so as you get older, it's also harder to thermoregulate even without these drugs, right? So for older folks, that means that they're especially at risk of facing heat-related illness or even death. And you see this kind of trend not only in older populations, but say amongst the incarcerated, right? So if you're in jail, you already don't control your thermal environment. You don't have access to air conditioning. You might not have access to ice, to regular water, to showers, and you're also probably heavily medicated, right? So the American prison system is the largest purveyor of psychiatric drugs in the nation. And so those drugs are going to heighten your vulnerability to extreme heat.
So then following up on that, especially think about the incarcerated population you just mentioned, what can be done to actually help protect those people?
And this is a great question. I think it's really important that we understand that climate adaptation is also public health, right? And that can take forms that look really different than what we're accustomed to. So maybe that means, for example, fighting to have people be able to take different kinds of medications during heat waves to modulate how much they're taking or what kinds of drugs they're taking. Maybe it means pushing further and saying, well, if prisons can't keep people safe, we might get rid of them. We might, think about abolishing prisons, thinking about letting people free in order to kind of protect their lives, and thinking about that as a climate adaptation policy and as a public health policy.
Fascinating. I want to take a chance to bring Ben into the conversation. So separate from extreme heat, I know you've been really looking at how climate can impact diseases, specifically dengue. So can you give us a little bit of an explainer on how is this impacting that, and kind of again to what Bharat was talking about, who is then most vulnerable?
Yeah, thank you. And I think that the issue of vector-borne diseases, like so many health issues, remind us that global change is a multi-scale and complex problem. And so as Bharat indicated, there's a lot of very localized impacts that we see. But we also know that warming in the Arctic might be very relevant to South Florida, or might be relevant to Mauritius because of the way that we're interconnected in this. And when you talk about something like dengue or malaria, these kinds of diseases, you have heavily mediated processes where ecology comes into play, where human systems come into play. And so you might see something like, yes, a gradual warming trend, changing the range of Aedes aegypti, increasing the potential range of dengue. That's something we think about. But you also see extreme events. And so, for example, we look a lot at malaria in the Amazon. And 15 years ago, we were talking about eradicating malaria from the Western Hemisphere. And now we're in control mode because we've had floods, we've had droughts that have destabilized these human systems, land use change. And these are the kinds of impacts that we're seeing, which again just point to the complexity of these systems and our need to take a holistic approach to the various impacts that climate change is having on the most vulnerable.
So then, kind of similar to the question of Bharat, like what's being done about it, what can be done about it?
Yeah, and so we just heard Sam Myers talking about planetary health, right? And so I think that framing is just so vital. And when we talk about something like vector-borne disease as an example, Is that climate change? Yes. Is it many other systemic changes going on? Absolutely. And then when you talk about solutions, as we all said, as Sam was explaining, that we need to talk about the communication side of this, and that includes very much a two-way, three-way, four-way, many-way communication, because what we're dealing with here are problems that involve multiple stakeholders that are have multiple objectives, right? What are you trying to accomplish with your solution? And the only way to do that is through this kind of participatory wayfinding, right? So I think something that we've learned over the years, certainly in the climate realm, but I think environmental health more broadly, is that you can only get to solutions if you work in concert with communities, whether that means the affected community, people who are part of the solution, people who are perhaps part of the challenge, right? And we've actually had some luck on that right here in Baltimore. We've done a lot of work through the Baltimore Social Environmental Collaborative, which I lead, where we've worked really effectively with our partners in city government and communities and industry to say, okay, let's really define the problem. Then let's work together to see what kinds of pathways are available to us, realize we're wrong, argue, there have been more than one shouting matches in these engagements, right? And then come around to a point where we can say, okay, well, here is a messy but acceptable decision process that we can all engage in going forward. And I think that's gonna be true for so many of the wicked problems we face under global change.
Yeah, well, I'd be remiss if I didn't ask, just very quickly, you're doing this work, the political environment has shifted. And so if there have been any examples that you can share about, has your work been impacted in any way, your ability to do this kind of research because of, say, a crackdown on grants or other things?
I mean, I can say briefly, personally, I had a National Science Foundation grant suspended, right? Luckily, it's back for now, but that impacts my ability to do this research. I think federally, we're all watching the endangerment finding come under attack, which is the kind of basis for regulating carbon emissions across this country. So there's a lot to keep our eyes on.
Yeah, and we've had several projects defunded, which is a huge challenge, obviously. In some ways, it accelerates the timeline of translational research. We always said that we were going to be able to make this self-sustaining. Now we have to do it faster. I have to say, going forward, I'm very concerned about us protecting our translational research. I'm also becoming increasingly concerned about the fundamental research. In some ways, making sure that our society values that fundamental discovery might be the bigger challenge, as we also try to protect the translational work that I think people do value and will come around to support.
Well, thank you so much. This has been a great discussion, and really, let's give a round of applause for Ben and Bharat.
Thank you.
Thank you.